there are many things, I think, that make our University of Chicago Celiac Disease Center truly unique. The most important thing is that we are very ambitious. So our goals is not just to be there for optimized patient care, or to be working for advocacy for celiac disease, or to be advancing research and science on celiac disease, or to be aiming at education. What makes us unique is that we really want to cover all these aspects. And we have a group of dedicated physicians and scientists within the center that work together to cover all these bases. So there is research, which is basic research, advancing in a really world-class way the field, really pushing the envelope and trying to understand and break new grounds in understanding celiac disease and possibly even reaching a cure. This is one of our main goals within the next several years, to actually find a cure for celiac disease. We also have, in terms of research, very active projects that go on that have to do with clinical studies on celiac disease on a number of different issues. And this is the research component. Our educational component has been always very, very active. It's at the core of the center mission. One of the examples I can give is the fact that we have been organizing for several years a unique course for doctors. We call them the preceptorship days, and this happens every year in December. And it's a 2 days full immersion, hands-on course on celiac disease that we offer to a selected group of physicians or dietitians or nurses from all over the country that come here to see how we deal with our patients, to hear informal lectures, advances in celiac disease, to discuss their own cases with us, to see biopsies and discuss them. So it's an intense course that we think is very useful to spread the word and increase the education. We offer on our website also a wealth of updated, clear and scientifically sound and clean information on celiac disease for our patients and for those who want to get information. And then on the area of optimizing medical care, we offer to each newly diagnosed patient with celiac disease a gift package that comprises a number of products that are gluten-free, and more importantly, brochures and education materials. So as you can see, there is a wide spectrum of activities that we do, and I'm just touching the tip of the iceberg here. Well, of course, a large bulk of our population is from the Chicagoland area, but we do have patients that come from all over the place. I've seen patients from Seattle or from Florida, from Arizona. We have patients from Texas. In addition, when we do our screening, one of the things that our center does, a free screening for celiac disease, we hold this usually in October. Typically, we have patients from 4, 5, 7 different states that travel to be tested by us. Well, as I said before, we are ambitious. So the main goal for the years to come is to find a cure for celiac disease. You may think this may not be that necessary. After all, we are dealing with a condition that is fully reversible on a gluten-free diet. In reality, this is not so. Studies have shown that about a third of the adult patients, especially with celiac disease, fail to go in complete remission on a diet. There is still some signs of intestinal inflammation that persist. So that's one thing. In addition, 3 to 5% of the adults that are diagnosed with celiac disease eventually develop what we call refractory celiac disease, which is a serious condition which has also some lethality associated with it, so some increased mortality. And so to find a cure for this condition would actually be absolutely beneficial. In addition, if you unlock the mechanisms that lead to autoimmune conditions and are able to understand how to block them, this might theoretically be extrapolated to other autoimmune conditions, thinking diabetes, thinking lupus, multiple sclerosis, etc. So our most ambitious goal, most definitely for the next few years, is to find a cure. We have an outstanding team of researchers led by Dr. Jabri that are doing this work in a really groundbreaking way. So I'm very optimistic about that. It will take time and money for sure, but it's at hand. We are ideally positioned for that.